Hi, I'm Tracy, a sales consultant with Dynasplint Systems. In this short video, we'll walk you through how to properly fit your Dynasplint device.
Push forward, give yourself some relief. And then
Please remember this video is a guide. Each fitting and patient recovery process is unique. Always follow the instructions given to you by your Dynasplint consultant.
It's important to note that Dynasplint is a rental item. If you have any questions about your device, billing, or your fitting schedule, don't hesitate to reach out directly to your consultant.
We're here to help. Let's get started.
The knee flexion Dynasplint.
So we're going to be fitting the knee flexion Dynasplint today. For this particular splint, we almost always lengthen the splint as far as possible to avoid this counterforce strap impinging on the back of the knee. So for Lisa, I have already lengthened this as far as possible to give me the most room behind the knee.
When donning a Dynasplint, follow the 6 fitting fundamentals to ensure an effective stretch and recovery. The knee flexion Dynasplint is most commonly worn sitting in a firm desk or kitchen chair.
You also can use this splint on your side, laying on your side, or in what we call a wall slide position. That will all be determined by your sales consultant at the time of your fitting, depending on your range of motion. So, Lisa, I'm just gonna have you lift your leg up. I'm gonna size you first. Okay, you could bring your leg down. Now notice, Lisa, even though everything feels a little loose right now, I'm lining the joint of the splint at your knee, okay? And you're sitting on this, which will help stabilize the splint later for you as well when we're putting this on and off.
Follow the guidelines and markings from your initial consultation. The upper strap attaches at the upper thigh, the lower strap at mid-ankle. Position and spacing are critical for the splint to do its work.
Okay, the most important thing about this splint is the positioning. Now what we need to do is get Lisa's thigh lifted, and we're going to take a nice thick towel roll. We're going to put it under the thigh. So that her foot is elevated off the ground and there is a clearance, space behind the calf. We don't want anything pressing up against the calf that would restrict her motion. Okay, so we're gonna add some tension now.
Initial tension settings are determined by your consultant.
Lisa, you would be adding this tension down the line when the splint is not on your leg. I'm just putting this on now.
To add tension, turn the screw inside the strut clockwise.
On both sides.
Ensure you adjust both sides of the device.
Both sides are even. And now, Lisa, you're going to sit with your splint in this position for the recommended time. If having the leg elevated like this might start to obviously tilt your hips and you might feel some back discomfort. A simple solution, it's either one, you could put another towel of an equal size under this thigh, or put something under the foot, which will just raise the leg and balance the hips out so there's no discomfort. Every once in a while, Lisa, you also can use your left foot, put it behind your ankle and extend out slightly just to give yourself a little bit of relief from the stretch, and then when you relax and remove it, it'll go back and resume stretching. The important thing to notice here is that these joints are at your knee. If you were to see these in front of your knee, you're gonna pull this higher on the thigh, okay? So we're gonna review getting this on and off next, and I'm gonna mark Lisa.
Markings and labeling typically remain consistent throughout your treatment. Once fitted, daily donning and doffing the knee flexion Dynasplint can be done differently, depending on the patient.
When we're removing the splint, we're gonna lift the leg up. You're gonna take the towel out. Now you can scoot forward a little bit. There you go. You're gonna open this strap. You're gonna fold your edges over. Now, the first method I'll show you is not opening this. And we're going to just slide Lisa's foot right out of the splint, and she's out, okay? We're gonna put it back on by sliding in Lisa, what I want you to do is keep your foot on the floor and bend as far as you can, okay? You're gonna pull this splint right up into the center of the knee joint. Now, what you're gonna do, Lisa, is you're gonna grab these 2 bars, you're gonna pull them up against the thigh, and you're gonna sit back on it. I want you to sit on it. Beautiful. Beautiful, okay? Notice she stayed in perfect alignment. And the last step is to apply your towel. For some patients, we would open and close the 2 straps. And now you're gonna see that completely bend back. It's normal, obviously, to see the splint bent like this. So the first step you would do here is lift the thigh up, put this under the thigh and line the joint up first. Beautiful, okay? You're gonna close that one first. And now you would just pull this forward with one hand from behind and use that hand to close that. And just bring it to my line. Beautiful. Last step, as always, is towel right under the leg. And there you go.
That wraps up your fitting overview for your Dynasplint system.
As you continue wearing your splint, remember to track your daily progress and reference your Dynasplint program booklet.
It's there to help guide you and keep your recovery on track.
Slight discomfort when removing the Dynasplint is normal. However, if that discomfort lasts more than 30 minutes, please reach out to your Dynasplint consultant.
If you have any questions about your fit, schedule, or rental details, we're here to help. Your consultant is your best resource throughout this process.
Thanks for watching, and we're wishing you all the best in your recovery.